Now we'll look at the anterior tibial artery, and we're looking at the clinical importance of the anterior tibial artery. So this is the anterior tibial artery just below your knee. Okay, is this below the knee? Yes, it's below the knee. Anterior, of course, it is on top. So for the anterior tibial artery, why we actually study that artery is because it could actually be a pulse point. Do you understand? You know, there's a dorsalis pedis pulse down in the leg. So, you know, you study this artery because the dorsalis pedis artery comes from the anterior tibial artery. Okay, so it's very nice for you to know the cause where the dorsalis pedis artery comes from. So clinical relevance, the artery may be affected by, you know, well, not the artery, you know, only, you know, but you should know that anytime you check for the dorsalis pedis pulse and the pulse is reduced, you can now start suspecting for things like arterial occlusion, peripheral vascular disease, trauma. Understand? So they usually use that in vascular examination in the hospitals and all of that. Then peripheral vascular disease, so the artery could be affected by atherosclerosis and diabetic vascular disease. That's when you have high sugar levels in the body. So this sugar is actually being deposited, you know, in blood vessels. That's basically diabetic vasculopathy. So clinical signs is the patient have claudications. When they walk, it's painful. They have foot ulcers and also delayed wound healing. You can also have gangrene of toes. So diagnostic importance, you can also be using all those Doppler ultrasound and angiography, you know, and all of that. So now is basically trying to evaluate the peripheral vascular disease. So this is a dorsalis pedis pulse that we're talking about all along, you know. So if you come up here, if you draw it back down to the knee, you find the anterior tibial artery there. So collateral circulation, of course, is a member of this rich blood network around the knee. Okay, so they ensure that there's steady blood supply to the knee. So clinical importance, it provides collateral flow in cases of popliteal artery occlusion, helps to maintain perfusion of the foot when the posterior tibial artery flow is compromised. It's also critical in limb salvage during vascular disease or trauma. So surgical importance is often used in distal bypass graft for limb revascularization, you know, trauma repair, you know, used in flap surgeries. Then diagnostic relevance, right? So basically it's nice. Okay, this is what we got for this.